Hello, everybody. It's Monica Heltz with your daily Fishers Health Department update. So, a couple of things that are good news today. The percent positivity rates and the case rates nationally have been going down. I think this is the fifth straight week, so that's good news. At the state level, we've been trending downward generally also. And from the county level, the percent positivity rate has gone down over the past few days, and it's now at 4.9%. So that's really good news, and it's, of course, headed in the right direction. Um, of course, all of these things are in context. That's why we have multiple metrics. Our Fishers testing site currently is running still at a 7% positivity rate, and we still do have a quite high case rate of about 20 a day, 20 cases, new cases per day. So we would like to see those things go down as well, and match what we're seeing at the state and the county level with the decreasing. The state is still well over 5%. As you know, we don't live in a bubble, but Hamilton County right now is looking pretty decent. So I'm very hopeful that we're starting to turn the corner on these things. All of this, of course, depends on the ability to have appropriate access to testing and quick testing, rapid turnaround, contact tracing, and all of those things. I think that we're positioned really well from a testing capacity standpoint. We're getting ready to increase our testing capacity, and there are several new sites popping up in Hamilton County as well. I don't know that that's true for the rest of the state, but for those of us here, I think that we'll be well positioned to have easy access to testing. So if you are having symptoms or somebody you know is having symptoms that could potentially be related to COVID, please encourage them to get tested as soon as possible and to isolate at home while they're waiting their test results. And if you've been in contact with somebody who could have been, who was put COVID positive, I would encourage you to get tested for that as well. And good news as far as testing goes, we are trying to support the reopening of schools, and to support those, we are decreasing our testing age limit down to 5. So coming up in the next week or so, we should be lowering that age limit to 5 and up. So anybody 5 and up will be able to get tested through the Fishers testing site. When that is up and ready, we'll push that information out on social media for you, and you'll be able to register your child on our Fishers Health Department website. But we'll send out further communication when that's all going and up and ready. And again, it should be just in time for the elementary kids to get back in school. So please know that we're trying to support you in that way. We will probably consider taking it down even further, as low as 2 at some point, but we want to make sure that the 5-year-olds and up, that goes well, and that our testers can learn from that experience as we continue to decrease the age limit. The other thing I just wanted to go over in preparation for sending the kids back to school was the State Department of Health put out some new guidance today as far as when to keep your kids home, who else might need to stay home, and when they can come back to school after they've been sick. So I thought I would share those things with you. So first of all, if your child is sick, you do not want to send them to school. Please do not do that. Please do not try to give them a fever reducer or something like that just to keep them in school. Please be responsible and keep them home. So I'm sure that you guys are all going to do that, and that's amazing. But you may need to know when they can come back and if anybody else needs to stay home with them. And the answer is, if they have siblings who are also in school, the siblings and you and your family will all need to stay home until that child can be ruled out for COVID. Now, the one way to rule them out for COVID is to have a note from a physician that says this is not COVID related, they can come back to school. The other way to rule them out for COVID, that they can come back sooner than the 10-day isolation period, is if they have a negative test, their symptoms have gone, and they do not have a fever in the last 24 hours. So if they can meet those criteria, then they can come back sooner than the 10 days that was initially suggested by the state. And then their siblings, provided their siblings didn't have symptoms, their siblings could go back as well. The other caveat is they can't have been a close contact with somebody with COVID, because all close contacts, as we've discussed before, need to quarantine for a full 14 days. So the good news is you don't need a doctor's note. You can have a COVID test instead. And again, we're trying to support you guys with that by lowering that age limit for testing so that you don't have to get a doctor's note every time. The bad news, of course, is that the siblings will also need to stay home until that proof is available. So that's the new news from this state today. Hope that helps you prepare and make plans as you're getting ready to send some more elementary kids back. And you guys take care, be safe out there, and have a great day.